Basically has three stages. First one is exposure, when you're exposed to it. All the tests will be negative. And second stage is latent, when the infection actually starts and it is contained by the immune reaction. The third would be active, and that is what causes the most problem when the bacteria is actually multiplying in the body. So it was first discovered in the 1882 by Robert Koch, and that's what led to the treatment of this problem. Now we will talk about specifically what bone tuberculosis is. Bone tuberculosis is basically the transfer of bacterium from lungs into the blood. It goes into the blood by hematogenous dissemination, and we will further discuss what it is in the pathogenesis. So the epidemiological situation is that in the world at the moment 30% of the population has latent infection, and 10% will reactivate over time. 10 million people with active infection, and 10% of that will die every year. It also includes the etiology of the tuberculosis, which is that the infection is spread via air droplets. It gets into your body, and once the infection goes to latent phase, it is then transmitted to the other people via the active state that occurs right after that, by the help of macrophages that are infected with the bacteriums. Once the bacteriums are into your blood supply, they can get to your bones after getting into the thoracic duct that is later on drained into the subclavian vein. Subclavian veins then takes the blood to the artery that is a nutritional artery that is in the bones, that takes it inside of the bone and kills the osteoclasts that are inside the bones, the cells basically, and it causes the same reaction as the primary tuberculosis. And after that comes the diagnosis of tuberculosis. The diagnosis would be, we would use the synovial fluid test, which we will be able to see the bacterial infection inside of it. And also, you can use some other tests like HIV test, which is basically injection of it inside of your skin. And the statistics also include 1.7 billion people were infected in 2018. And now we'll go to the statistics of Kyrgyzstan. Kyrgyzstan basically had a lot of cases. In 2015 journal of WHO, about 141 people out of 100,000 were infected in Cherry region, and that was the most affected region in this whole country. Then comes the last minute, I will go over the treatment. Treatment includes four important medicines, which is rifampicin, isoniazid. These are the first two, and these should be given for 6 to 18 months of time. And if they're not given, they cause more problems, and which you have to introduce two more drugs, ethambutol or pyrazionide. These two drugs have to be tested on a person if you can take these drugs or not, because they can lead to permanent or temporary blindness. And at the end, these are slides for the people that don't understand English. And at the end, I would like to conclude by saying that this is a very treatable and curable problem. We can contain it by wearing masks and providing facilities to the people that can't access the medical care with the money that they have. So also, as a student at this university, we should be including it as a dissertation in our bachelor's course. And as future doctors, we should be helping out the people that cannot afford the healthcare on their own as betterment for the whole humanity. Thank you very much, and have a wonderful day.
Спасибо. Thank you very much. Here, вопрос, questions.
All right, I'll ask one question. Who do you think is at the most risk for tuberculosis? We're not talking about age. Please think about it. Who is at the most risk for tuberculosis? What conditions affect the prevalence of tuberculosis? Yep, you got it right. He's right about the answer. The immunocompromised patients are the ones that have the most prevalence of tuberculosis. Thank you very much.
Thank you very much, Abdullah.
अरे श्रीनिवास तौसीफ अब्दुल रहमान